Hi. Today we will discuss about urinary leakage in children, what we call as urinary incontinence. So typically this is a term which is used to describe a child who does not have complete control on the urination. Now, we all know that during infancy, infants don't have control on their urination. So as soon as the bladder fills with urine, they would pass urine as a reflex. But by the time they cross 1 year, 2 years, gradually they would get daytime control, nighttime control. So whenever a child who is expected to have a decent control of urination does not have the control, then we call it as a urinary incontinence. That is, these children might pass urine normally, but intermittently in between the passing of urine, they will usually wet their undergarments or their shorts or their pants with a few drops of urine. So this can be an intermittent leakage of urine without the child's knowledge, or it could be a continuous leakage of urine into the undergarment. There are some children who do not pass urine in stream at all. They would always leak continuously. Some children would leak or only in the night, that what we commonly call as bedwetting. Bedwetting is not a major problem, except when bedwetting is persisting beyond 7 or 8 years of age, or when bedwetting is associated with daytime urinary problem also. So we will cover bedwetting in another episode. So a child who has incontinence of urine or does not have complete control of the urine, it can be because of various reasons. One, it could be because of structural problems of the urinary tract. For example, there is a condition called as post-urethral valves. We commonly see incontinence in children with post-urethral valve. Post-urethral valves is a condition where there is a obstruction to the flow of urine below the bladder in the urethra. It's a congenital problem, and because of the high pressures in the bladder, even after the obstruction is relieved endoscopically in these children, many of these children continue to have an overactive bladder and they do not have complete control on the urine. They may pass normally, but they also keep wetting their undergarments or shorts or pants. That is one. So that is one of the structural problems by birth. The second is what we call as epispadias. Epispadias is a condition where the urethra of the penis is not properly formed. The penis itself is also not completely formed normally, and these children also have a defect in the pubic bone. So what happens is they have a short penis, they have a short and stout penis. The urine comes from the upper aspect of the penis, it seems to be coming from under the pubic bone, and many children with epispadias, and it may be associated with what we call as an extrophy of the bladder. So these children also have incontinence or inability to control their urine. Now, the third structural problem which can cause incontinence, what we see reasonably commonly in girl children, is called ectopic ureter. So what happens in ectopic ureter is these children are usually typically girls. They pass urine normally, but they also continuously wet their undergarments almost continuously, except when they sleep, except when they are lying down. Whenever they are standing position or sitting position, they keep wetting. So this is typically seen in some girls because of the ureter, that is a tube which drains urine from the kidney, not opening into the bladder but opening somewhere outside the bladder. When the urine starts coming outside the bladder, there is no control mechanism there. So, and many of these children have a double kidney on one side, which we call as duplex kidney. I think we will do duplex kidney in a topic we return in this session. So, these are the structural problems. The other important problem where the child has urinary, lack of urinary control is the problem with the spinal cord. So some of these children, they can have an abnormal formation of the spinal cord with some damage to the spinal cord nerves, which can affect their urination. Some of these lesions may be seen outside on the skin itself as a bulge on the back, lower back, or a tuft of hair, or some kind of a discoloration of the skin. But there are situations where we call as spina bifida occulta, where there is not much visible outside, but inside there is a problem with the spinal cord. So some of these children, when we are suspecting, may require an MRI scan of the spinal cord to actually see if there is any spinal cord problem causing this urinary problem. The third category is, I think we have discussed in one previous video, what we call as dysfunctional voiding. So some of these children, they have constipation, they hold on to their urine, they hold on to their stools. I think we have already made a video on dysfunctional voiding. Interested viewers can see that video. I have described in detail about dysfunctional voiding. This is basically an acquired problem, dysfunctional voiding. What we have discussed till now, all the things we have discussed till now, in this episode are all usually by birth problems, where they are not acquired. But dysfunctional elimination syndrome, dysfunctional voiding, what we call, is called acquired problem. It's called neurogenic bladder dysfunction. So they typically have something like a neurological problem of the bladder. The symptoms are similar, but they don't have any problem with the spinal cord. It's basically a functional problem. I would call it a problem of bad habit with both urination and passing stool. So again, they are of various categories, and once we diagnose them, we can treat them in the appropriate way. So typically, these are the causes of a child not attaining urinary control, complete urinary control, even at an age when, for example, by the time a child goes to school by 3 years or so, we expect the child to have control of the urination. So we don't expect the child to pass anywhere and everywhere in the undergarments, or to keep on passing drop by drop in the undergarments or in the pants. So if that happens, then it is better to see a specialist so that we can evaluate what is exactly happening. Is it a structural problem or is it a functional problem? Does it have something to do with the nerves? So once we do that, then we can tailor the treatment according to the particular condition. Now, the problem is sometimes these kind of inability to control urine, even when the child goes to school. Sometimes these children are in diapers even in school, and they develop a lot of inferiority complex when they see other normal children, and if the child is in diapers, or if the child continues to pass urine into the undergarments, which gives a lot of smell, urinary smell, to the friends and those who are sitting near the child. So it's not a good thing for the child to grow up in with such a problem. So, but most of these problems which cause the lack of urinary control in children are eminently treatable, and most of them are curable. So it is important that the parents recognize this and then take the child to the appropriate specialist, so that we can diagnose what is the problem, and then we can give the appropriate treatment to the child. I think we will cover individually each of these conditions in one episode video. We'll also cover bedwetting in a separate video. Thank you.